move to the next presenter, which happens to be Dr. Navneet as well from Beato. It's always been a pleasure hearing you, Doctor. So please, over to you. Just a quick time check. We'll have to be more adherent on the 8-minute
Hmm.
timeline, and in the interest of other startups also
Sure.
getting in the queue. Over to you, Doctor. Thank
So
you.
thank you, Tushar. So at the outset, I wish to thank the entire organizing team of DTechOn for organizing such a first virtual conference of technology in diabetes, and I must congratulate them and for inviting me and to discuss the technology in diabetes. So basically, we know that the technology is the fifth pillar, one of the main five pillars of Atmanirbhar Bharat. So the Beato, through its largest digital care ecosystem, is helping patients to manage and control their diabetes. If we see the the journey of a diabetic patient, be symptomatic, be asymptomatic, when a patient is being diagnosed as a diabetic, the first phase is denial. Or sometimes like people go with the hearsay and they start treatment with the indigenous medicines or their homemade medicines, or like they just delay the diagnosis, or they just delay to go to the consultants. So the denial, and then they go for a like Google or WhatsApp, and maybe they're starting the treatment from their own. And many of the patients, they just don't like, even they start the treatment, they have a treatment interruptions, maybe because of the awareness, maybe because of the affordability. So even when they have been prescribed or they have consulted a doctor, they have started with the treatment maybe in a month or 2 months, and when they come to the normal like fasting, PPG, and even the A1C come down, they stop the treatment and they say that now my diabetes is fine and I'm over, like I'm non-diabetic now. So there are many of times they have no scientific or like the proper knowledge or awareness. Second challenge in patient with diabetes is non-adherence. Patients started with like 2 times of oral antidiabetics or even with insulin therapy. They stop the treatment or they reduce the medication of their own. Many of times there may be financial constraint or the behavioral issues. And the follow-up is a major challenge because like we have seen the patient, those who are coming for a follow-up at 6 months, 1 year, with the A1C of same 8.4, 8.3. So the entire journey from the diagnosis taking this 2, 3 years, and finally the patients are having an A1C of 8.5. So that's why almost around 80% of the population is not yet controlled in India with the average A1C of 8.5. So the major challenges, the fundamental challenges of diabetes management in India are the accessibility, awareness, and affordability. Whenever we talk of accessibility, 95% of the people with diabetes are in tier 2 cities and beyond. And these are the patients who has to travel to the cities or to the major towns to consult a diabetologist or an endocrinologist. That will include a workday loss and the cost of the traveling. Almost only 7% of the endocrinologists and diabetologists are in India are in the tier 2 cities and beyond. So only 8% Indians manage to treat their diabetes with a specialist. So just imagine the huge burden on a patient which is not getting access to a diabetologist or a specialist, to a physician. So like they are not being getting a proper treatment. Then comes the role of awareness. We know that half of the patients of diabetes are still undiagnosed, and half of the patients, those who are diagnosed, only half of them are taking treatment, which we call it as the rule of 50. And 80% of Indians with diabetes in India have an average A1C of 8.5. And 70% Indians are unaware that diabetes can impact the other organs or it can cause the damage to the vital organs. And only 10% have even introduced the diabetes educators, so they don't know like what is the lifestyle management. And as far as the affordability is concerned, yes, we know that almost 70% of the population of India is in the rural population. And affordability is a major challenge because like they have to pay from their pocket for the consultation, for the investigation, for the medicines. So this is a huge burden on the family. And in fact, there is a data where it has been seen that the 25% of the monthly household income of a lower middle class is spent on the management of diabetes and its complications. So Beato has created a holistic ecosystem to bridge this gap in diabetes management. And how come? Like once the patient comes on the app, patient downloads the app, he get an access to the healthy lifestyle management. Like for the medical nutrition therapy, he can have an access like what amount of calories, what amount of carbs this particular food has, so that he can have his choices about the food intake. So this is for the medical nutrition therapy, and even he can get connected with a coach and can get an advice. So for the medical nutrition therapy, he can choose have a healthy choices about the diet. Then this app is being synchronized with the different say like health apps or like the health fitness trackers, wherein he can monitor his physical activity. So and he can have an idea about the burning of the calories, how much calories he's burning in a day. So he can have an access to the first pillar, that is the lifestyle management of type 2 diabetes. Then second challenge is the monitoring. So by just an affordable connected kit, he can do a monitoring at his home, and this monitoring, or like whatever his blood glucose values are there, they can be in the app, so he can see at any point of time, and he can see that to take medicine. So like this app has an access to the blood glucose reminders and the medicine reminders, so that it will improve the adherence and the compliance to the treatment which is being prescribed by the doctors. And then you have a caregiver alerts. So like if the patient is having extreme hypo or hyper, your loved ones or your consultants or your doctors will get an alert, so that they can manage properly early. Then you have the patient who's on the app can have an access to the entire data in the graphical form, in the like day wise. He can access like what is his fasting is going on and the PPs are going on, and then on the base of that he'll get an advice on the base of that your glucose is going low or is going down or it is going high. So what should be the ideal approach for the managing it at home with the help of a medical nutrition or the dietary intervention or the physical activity. But if there is any extreme hypos or even a patient wants to talk, he can ask for a call from the coach. So there is a proactive care wherein a nutrition or the certified diabetes educator is educating a patient, imparting awareness, imparting the proper knowledge about the diabetes, its complications, its management, and what should be the entire like about the monitoring also. When it comes to the doctor involvement, as Dr. Amit was saying, I'll be discussing that on the next slide. So even a patient with the doctor connected app, so the doctor can see the extreme hypers, or like the presentation of all the monitoring in his dashboard at his end, so that he can see that what is his patient is doing like. And of course, at the last but not the least, patient will have the access to the exclusive diabetes educators videos, the articles, so that he can have a proper awareness, proper information, and proper knowledge about his or her own diabetes. Because we know that diabetes education is the important pillar of managing type 2 diabetes in the long run. So what we have done so far, we have almost more than 4 lakh members on our this IoT monitoring program, and the retention for 1 year is almost more than 60%, and average time spent on the app is 10 minutes. Just imagine, so like patients are giving 10 minutes average daily on the app, and this has impacted the clinical impact of this is that we have seen a reduction of 1.9%, the average A1C in 3 months, 10% average drop in fasting blood glucose in 1 month, and the reduction in the hypoglycemic events by 52%. So it's not only managing the hyperglycemia, but it is also managing or preventing the hypoglycemia. So helping the patients to keep them in euglycemia to achieve the target A1C to prevent the complications. And we are not just restricted to the metro cities. We are not just restricted to the upper classes data. We have almost 70% of our members from the non-tier 1 class, and 55% patients are from the first time users of glucometer, and 83% users connected with diabetes. They connected with the educator for the first time. So that's imagine the 83% of this population has not even visited an educator or a certified diabetes coach. And this reduction in A1C is sustainable. If you see in patients, almost 28,000 plus patients, the average A1C or the mean A1C at the time of onboarding was 8.2, and it was sustained to 7.3 at the 2 years. In patients who are having A1C of more than 8, the average A1C was of 9.6, and this came down to 7.6 at 2 years, and it was sustained for that 2 years. So like there is a sustainability of this intervention. And as Dr. Amit was saying, that we have to involve more and more doctors, because there are millions of patients and this population is growing. So we have a program, this Doctor Connect program, wherein the doctor who is treating, we are making a bridge, we are making a connection between a consultant diabetologist and his patients, so that whatever the patient is monitoring with that glucometer at their home, a doctor or the consultant diabetologist can see on this dashboard how his patient is doing. And this Doctor Connect program has improved almost 6 times higher in the monitoring, and the average daily, again, that patients are spending 10 minutes on that. And this has shown an 11% drop in the average fasting blood sugar at 1 month. So even a doctor who's connected with his patient, whatever the patient is monitoring, patient is seeing on the dashboard. And in this loop, there is an educator either from the doctor or from our end. So this educator is taking care of this entire loop, that it is imparting a proper information and knowledge to the patient, and with the help of a doctor, so that the doctor and the coach and the patient are a closed loop system, and where they are helping the patient to manage his day-to-day like activities and the fasting blood glucose and the post-prandial blood glucose. And this whatever like we have done, it has been published at length. So if we see this is the abstract from the ADA, where we have seen the 8.9% reduction in the PPGs, 9.3% reduction in the preprandials, the 9.5% reduction in the fasting blood glucose, and 6% reduction in the random blood sugars. So this is just with the help of this real-time feedback and counseling from our coaches, it has impacted the glycemic control. And this is the real-world data. It is not from a very clinical trial or a very say prospective trial. It is a real-world data. And same, this is again the real-world data where we see in the 45% reduction in the postprandial, almost around 40% reduction in the preprandial, 51% reduction in the fasting, and as well as the reduction in the hypos. And this is in the real world. So like in the almost 25,000 patients. So like these are the patients which are already using the app. They are already on the connected device. So they are having this impact. So this is the data from when the patients are using in their day-to-day management of diabetes. This is again where we have seen the 60% reduction in the hypoglycemic episode. So we are managing hyperglycemia. We are also preventing hypoglycemia. So ultimately providing a holistic approach, or we can say the euglycemic approach to the patient, those who are members on our Beato app. This was a poster which was published, like accepted in the ATD. Again, there was a 60% reduction in the blood glucose levels, average blood glucose levels, 81% reduction in the fasting hypoglycemic incidents, 72% and again in the pre-meal hypoglycemic incident. And this is in the data. And this was during the COVID-19 time, when the patients were at lockdown, patient in the home. They were getting a care from our coaches, from our educators, and they were managing their diabetes with the advice of our educators at their home only. This is the abstract which has been accepted in this DTACon, where we have seen that just by the educator, just by the one coach call, there is 12.45% increase in the frequency of monitoring. So that the patient is now more aware, patient is now doing more monitoring, and by which that we have just a reduction in the hypoglycemia in almost more than 3,000 patients. So this is the real data of 3,000 patients who are already using, and they have a reduction, almost 80% reduction in the hypoglycemic incidents after one coach call.
Dr.
And so we have impacted, yes,
this is
animals, and this is just not like the patient, but if we get a feedback from the patient, we know that ultimately our patient are benefited, then only we can be happy. So this is just the feedbacks from the patients. And these are some awards where we have won the National Startup Award last year. And these are some collaborations. And so to summarize, what I can say that to bring the democracy in diabetes through the technology, and to make the India as diabetes care capital of the world, we can take the help of philosophy of Gandhiji, that is Sarvodaya through Antyodaya, which means the development of all through welfare of the weakest section of the society. So that is the aim of the Beato, to achieve or to democratize the diabetes management, to take care of the patient, those who are having less accessible or less affordable, even in the outreach or the far areas of the country. So to provide the overall treatment to the overall population or the type 2 diabetic population of the country. Thank you very much.
Thank you so much. Very inspiring, Dr. Navneet.